Hey everybody, this is Dr. Sanders here with Integrated Health Solutions. I want to talk about another specific area of pain you may or may not have experienced, but this has to do with heel pain. And this can be pain anywhere from the back of the heel to the right underside of the heel. And sometimes you may have been diagnosed with, you have plantar fasciitis, but it's very specific pain centered around the heel. That pain can be coming from referral patterns of trigger points from other muscles, particularly muscles in the lower leg. A couple of the muscles that do refer there is the gastrocnemius, sometimes referred to as the calf muscle, as well as the soleus, which is close by the calf muscles, along with other muscles can refer pain to this area. So today I want to help you understand a little bit more of why that is and what you can do to take care of it. But first of all, we find tension buildup places in muscles a lot of times can also reflect or transmit painful areas on the places they attach to. For example, the gastrocnemius, so as they attach to the calcaneal bone. If they have tight areas, they can pull up on that bone, causing a tension on the other side of, or in this case, the bottom part of the bone, because they're attached to the top part. So they pull up on that part, it will pull the calcaneal bone a little bit this way, creating a stretch. If this area represents the plantar fascia area, it can create an increased stretch on that plantar surface. And then every step you take, the gastrocnemius is pulling on that calcaneal bone, causing further tension on the plantar surface, causing the irritation to develop either at the attachment site on the kind of Achilles tendon side or on the plantar surface side. And people may ask, why does this happen, or where does this compensation take or begin? And that can be a lot of different answers, but one of the ones I find commonly in my practice is the plantar surface muscles become basically obsolete to the body. It chooses to utilize the bigger muscles, particularly the calf muscles and the muscles around the calf, to help control the ankle. Some of the things that can cause this is a bad sprain, ankle sprain, or repeated ankle sprain can over time cause imbalance, overstretch of those ligaments in that calcaneal bone, will either cause the plantar surface muscles to overwork or stop working, because during the time of injury, the body would have not used the plantar surface or the ankle very much because it was injured. So it babies that area and will not use it as much. So it becomes stiff and weak. And then when the body goes back to use it, sometimes it will exaggerately use the larger muscles to help stabilize it, because that's what it was probably doing before, because the ankle and the surrounding ankle areas were irritated. And so thus we get this compensation of the body continuing to use calf muscles, lower leg muscles to support that ankle, which it's overkill for the ankle and actually can wear down the calf muscles, so the gastroc muscles themselves. To take care of those, what we want to do is manage the tissue tone of all those muscles involved. And since the problem, what I'm talking about, is more in the big muscles pulling in them, we want to try to release tension in those calf muscles so that it will stop pulling as much on that calcaneal bone, causing that imbalance in the plantar surface or at the attachment site of the calcaneal bone. So a good way to do that is rolling. Rolling helps to create a moderate degree of stress, a healthy degree of stress in the tissue that can help increase blood flow there, making the tissue more hardy, less reactive, and therefore less reactive, the tissue will become less tight, not overreactive when the body needs to use it. So to do that, we're going to utilize a foam roller for the calf muscles. Now, if you ever rolled out an area, we're going for a hurt good kind of sensation. What we want to do here is we want to get on the ground. I recommend doing one leg at a time. This leg is for control. We've got our arms here for support, and we're going to kind of do this crab walk motion on one leg. We can start mid-calf, or you can start right at the ankle, whatever floats your boat. I like starting with the ankle. And then we're going to roll down to the top part of the lower leg, the back side of the calf muscle, right off to the back side of the knee, and then roll back to the ankle. All that area. Now, the calf muscle has several different parts, primarily two. So there's an inside and outside part, so we can angle our foot here and do the inside. Once again, we're crab walking to right up behind the knee, right, and then we can do the outside here. A little better here. Start here, we can do the outside, top of the knee, and the inside, top of the knee. And you'll want to roll it for about 30 seconds. If there's active symptoms, multiple times a day, like 3 to 4 times a day. If you're just trying to maintain good tissue tone in there, good amount of stress a little bit every day in these areas can help maintain a degree of desensitized, less irritated muscle tissue so it won't be so reactive once a day. But 30 seconds to a minute is great, and make sure to do both sides. If there is a lot of discomfort, try maybe 10 seconds start. If you can't even do 10 seconds, then it probably means that the extent of irritated tissue in that calf muscle is pretty extensive, which means you'll need other forms of treatments to try to reduce that tension by reducing that stress in there, that healthy stress. And we here at Integrated Health Solutions, we have a myriad of techniques that we can do to help apply that right amount of stress to get the same reaction to release that tension in the tissue. Make an appointment, call, or go to www.ihsne.com. Make yourself an appointment so we can check that out. Thanks for your time today. Check us out.